Okay, I think we'll get started. Welcome to the Care and Learning, or CandL, Family and Community Engagement Listening Tour Data Report Out. We are so happy that you all have taken the time to join us and hear about what's most important and aspirational to families with young children, to providers across our state. I'm thrilled to be joined by brilliant colleagues, and I'm in fact going to turn it over to my colleague, Shonda Sumter, the Deputy Director of Community Engagement at NC Child, to discuss some housekeeping rules. Shonda?
Hello, and welcome to everyone. Before we get started, I have some quick housekeeping and instructions for everyone. This session is completely bilingual in English and Spanish. We have a live interpreter on the line. And to choose a channel, look for the little icon of a globe and the word interpretation on the bottom right side of your Zoom screen. Again, it is a little icon of a globe and the word interpretation on the bottom right side of your Zoom screen. Click that globe icon and then choose either Spanish or English. Murtado.
Thank you, Shana. Bienvenidos a todos y muchas gracias por estar aquí.
Welcome, everyone, and thank you very much for attending today in this important event. In the lower part of the Zoom screen, you will find the option for listening the whole presentation in Spanish. You can find a little globe-like icon that says interpretation, and you can choose either Spanish or English. If you're using a tablet or a cell phone, you can go where the three little dots are, and you can choose more options, language interpretation, Spanish, and Finnish in order to activate this function.
That sounds great. Thank you so much, Shonda. Gracias, Murtado. And again, welcome. This is a really exciting day for us. We are thrilled that this listening tour has concluded and that we can share all of the really important insights that we've heard from these families who've shared really intimate aspirations for themselves and their children, their families, their communities with us. I wanted to get an icebreaker going today. Claire has just put it in the chat. So as we're just warming to one another, as we kind of sit with this data and think about it together and ask good questions, if you could have taken credit for any invention in history, what would you choose? And please feel free to drop it in the chat. I was thinking about this, and I was thinking, there's so many great inventions that have been life-saving and that have been innovative. And but then I think about my own life and my own world, and what I came up with was OxyClean, because I use it. I have 4 children. I'm constantly fighting stains, and it is my trusty laundry room companion. So I would go for OxyClean. But please, I encourage everyone to share with us in the chat what their invention would be. Looks like the chat is disabled. Is that something that we can fix? Oh, here we go. Velcro shoes. Post-it notes. Velcro shoe. That's a really good one. Indoor toilets. Yep. Bicycle, antibiotics. Swift Army knife, air conditioning. In a place like North Carolina, we're starting to get into that season for sure. Vaccination. Washing machine and dryer. Very good. Refrigeration. Wireless headphones. Coffee. Susan. That's a good one. Sharpies. Nothing like having a fresh set of Sharpies. Ooh, Aquaphor. That is some good stuff, Devanya. Zoom interpretation channels. Yeah, those are really helpful. Really helpful. Well, thank you so much for sharing some of those with us. It's just a nice way to kind of get to know the folks who are in the room and to get your insights into what is particularly helpful to you in your everyday life, for which you would love to take credit. So with that, I'm going to hand it over to my colleague, Shonda Sumter. Again, she's the Deputy Director of Community Engagement at NC Child. She really has been our guiding light of the candlelights, and is project manager and is project managed us all to make sure that we have our tasks done in a timely manner, and that we could get this reporting out to you today. So without further ado, Shonda Sumter.
Hello and welcome, everyone. Today is the day, and I'm super, super, super excited that we get to share this data with you all today. And so before I turn it over to our friends at the link group who has all the knowledge, I will just give you a little background about how we ended up here. Like, how did we get here? So just a little bit of level setting for us. So CandL stands for Care and Learning. And as you can see here, I have the C, the A, and the D, and the L in white and everything else in yellow. So you can see where our acronym came from, but it's Care and Learning, hence the word CandL. And Care and Learning is a long-term early childhood education campaign. And the goal of CandL is to move towards a more publicly funded early childhood education system in North Carolina. And so I'm going to just run through with you just the phases, right? You all, if you are connected to our CandL newsletter, you are very familiar with these phases. If you're not connected to our CandL newsletter, Lindsay will drop a link in the chat right now so you can actually get connected to our newsletter, so you can hear what's going on with CandL monthly as we move through these phases. So phase 1 is the intense data collection. It was supposed to be 9 months, but it turned into a lot more because we actually added 10 additional counties in the West, which we're very, very excited about. And so it extended through April of this year. And the team that was responsible for phase 1 is the Family Community Engagement team. And so I want to take this time to give them their flowers, because when you're talking about amazing team, oh my God, yes, I was, trying to pushing the car forward, but these group of leaders, CandL leaders, I could not have done it, or it will not have been done without these group of people. So excellent work to these people that actually represent our CandL leaders on the Family Community Engagement team. Awesome job, team. And then next is our phase 2, which we'll be moving into next. Phase 1 is not ending. We're done with the data collection, but phase 1 will continue through the end of the year, because our Family Community Engagement team will continue to engage our community and making sure that we're staying connected to them and making sure that they kind of know what's going on and providing training and things like that. So phase 2, we're going to start moving into phase 2 actually this month, and that is the completing the vision for the campaign. And so before all this began, our leadership team, which is our decision-making body of CandL, they came together and put together a vision of what we thought the vision of CandL should be, right before we did the data collection. But we made sure that we put in phase 2 for us to actually go back and revisit that vision. So we're going to go back and revisit that vision in phase 2, and we're going to put it alongside the data that we collected. And wherever it does not match, if the vision does not match the data, we're going to change the vision to match the data, so that we're staying true to keeping the community at the center of everything that we do. And the leadership team, like I said, is responsible for phase 2. Phase 3 is the policy team, our policy experts. This is where our policy analysis, policy gap analysis will happen. We will pass the torch to the policy team in phase 3. And the policy team will then look at the visioning that has been tweaked, look at the data, look at the policies, and then they will make policy recommendations to us. So this is where they're going to tell us what policies need to be changed, what policies need to be added, what policies need to be done away with, and give us some policy recommendations. These are the things we think you should focus on that's going to give you the best bang for your buck. And so that's what we're going to be leaning on the policy team for that. In phase 4 is when we'll choose our priorities. They'll pass the torch back to the leadership team, which is our decision-making body of CandL. And then we will choose priorities. We will look at the policy recommendations that came from the policy team, look at the visioning, look at the data, and then choose a couple priorities to focus on. And then phase 5, launching the campaign. And while all of these phases are happening, phase 1 will be, we will be continued to thrive in phase 1, engage in the community and making sure that they are abreast and know what's happening with CandL, so that when we get to phase 5, they're ready to go. All right, and so let me tell you what we did in phase 1. We went to 34 of North Carolina's 100 counties, and we listened. And so here's a map, if you're a visual person, that shows where we went. So the colors mean different things. Purple represents where NC Child has CAN hubs, and our CAN hubs actually hosted listening sessions for us. Our blue is actually our pilot organizations. These are the pilot counties that we went to before we started the listening session tour. We wanted to kind of see what worked and what didn't work. So those are the pilot counties that we went to. And then the 17 in yellow, those are the additional that we had to make 24. And that was our original. And so then you have the orange, the rustic orange color that you see here. And those are the 10 additional Western counties that was added probably more than halfway through the list, which gave us a total of 34 listening sessions across the state. So here's a visual of where we went. And then I'm not going to go through all these, but just showing you in each county who our partners were. We partnered with grassroots organizations in each one of these counties. We actually awarded them with a $5,000 mini grant. And we know it doesn't cost $5,000 to host a listening session, but this was a 2-part deal where we were able to kind of leverage their relationships that they have in their communities, but also support the work that they're doing on the ground. And so it was a win-win situation for everyone. That approach we found to be probably the best. I mean, there were so many different advantages to doing it that way. The relationships we built, the folks that are connected to CandL is just amazing. And so now I know what you want to hear is, what did we hear? So what did they tell y'all? And so without further ado, I will turn it over to Laura from the Link Group, our friends, her and Grant, to actually take it from here.
Thank you, Shonda, and thank you all for letting us be a part of this really fantastic and important work. I'm Laura. I'm a partner with the Link Group, and Grant Morgan, who is my colleague, will also be presenting with me, and he has been really integral in this data as well. So we are excited to share with you what we heard from the community. So first of all, we listened to 514 voices and throughout the state, and this represented both parents and caregivers as well as childcare providers. And we also wanted to call out the differences and ethnicities that we heard from, because this is really important to ensure that we are hearing from all voices throughout North Carolina and that everyone is represented in these findings that we have here today. We want to say thank you. As I mentioned, this is really important work, and we were really inspired by listening to these 514 voices throughout the state. There were times when it was clear that these voices were frustrated and infuriated, but also inspired and hopeful, and that translated to us as well. We really loved hearing about the inspiration and joy in people's lives, and we really empathize with them when it came to the frustrations that around their struggles when it came to early childhood education and childcare in general. But we were really inspired by this because it's really their voices that's going to move progress forward, and that there's going to be progress in North Carolina in early childhood education. And we at the Link Group are really honored to just be part of this journey. And we really hope that we did these voices justice in this final analysis and report. So let's start with what we heard across the states. And one thing that we really aimed to help answer, and CandL was really interested in understanding, was how do providers, parents, and caregivers in North Carolina define quality childcare? And we heard three common themes come up over and over again. And it was really this three-legged stool of trust, affordability, and availability. And all three of those are needed to be in balance in order to have quality childcare. And that's really the ideal childcare. So without trust, parents don't feel confident that they're leaving their child in safe care. And without affordability and availability, parents just can't access childcare. And we also heard that trust, affordability, and availability are also the same pillars that providers are aiming to provide for parents and children. And there's a lot of frustration when they cannot provide this. Oops. Ooh. All right, let's get my mouse going here. All right, so what we're going to do is we're going to dig into these pillars a little bit more. We're going to talk about what it means for trust, what it means for affordability and availability, and what are some of the barriers for each of these pillars in each of these areas. One thing to note is that, we heard from 514 voices across the state, and there were certainly nuances across counties and among different parts of the state. But what surprised us was that there was so much consistency in how these three pillars were defined by everyone. So what we take away from that is that there is common, universal, and urgent need throughout the states. Parents, caregivers, providers are all united in the need for trustworthy, affordable, and available childcare. There's a ton more detail in the full report from CandL, but we wanted to use this presentation to really highlight on the most important ideas in each of these pillars. So we are going to start with the trust pillar. Across all the counties, the one thing that really stood out for us, even more so than affordability or availability, was trust. And we hear some of this in the quotes, and we have sprinkled quotes throughout this report that are really coming from the voices that we heard in these listening sessions. So these are really representative of the actual voices that we heard. Parents want their child to be in a nurturing environment, and providers want to create a nurturing environment. But sometimes how that trust is defined by both parents and caregivers and providers is not always how the state defines trust and quality. And so we're going to hear that sometimes there's a disconnect that can be frustrating for all the different stakeholders. So let's dive into trust. What makes up trust, and how do parents and providers define trust? And the first way it's defined is passionate, loving teachers. Parents want providers who love what they do and want to be there for their children. And they're really looking for that good energy that exists between the provider and the relationship, provider and the child, looking for that relationship between the two. And when there is that good relationship, everyone thinks of one another as a family because of those close bonds that are formed. Providers also recognize that you have to love this profession in order to stick with it for so many years. And we're going to hear that come up as an issue later on in terms of finding staffing when it comes to availability. The other part of this pillar is well-trained providers. Parents want to know that teachers are more than just a babysitter, that they are properly trained in early childhood education. They want their children to develop lifelong skills and the foundation for those skills, things like potty training, reading, basic writing, knowing colors and shapes, playing well with others, and just preparing them for going into school. Providers also want to have access to training. They, again, love this profession. They are passionate about what they do, and they want to be the best teacher that they want to be and that they can be. And so they're always looking for more training so that they can be great teachers. This includes those students who have special needs and abilities. They want to make sure that they are trained in ways that they can care for those children and provide additional skills and abilities for those children as well. The third thing that goes into the trust pillar is the provider reputation. So what we heard is that many parents really rely on word of mouth and from recommendations from their friends and family in order to find a provider. And this is for two reasons. One is that they really trust those firsthand accounts more than anything else. And the second is that they don't really know where else to go to access information about providers. And what we heard from the state is that many wish that there was a centralized location where they could go find information about providers in the area. Right now, they're not aware of where that information may lie. And it was interesting, during some of the sessions, they were actually information sharing during those sessions about where to find providers because many parents did not know. We also heard from directors and providers that they understand how important word of mouth reputation is. And that's one of the reasons why they spend so much time looking for the right staffing needs for their center or home. So the fourth aspect of this is reliability. And what that looks like is having consistency of staffing and also centers being opened consistently, which was a real barrier, especially around the time of COVID. Whenever there's staffing turnover, which we're going to hear about a little bit later on, that erodes trust because that means that parents have to start all over again when it comes to building that relationship with the provider and the child. And whenever a center is closed, that disrupts a parent's work schedules. And so what we heard from in-home providers especially is that sometimes they forego their own medical needs. They might skip an appointment because they know that if they have to close the center for the day or they're home for the day, and often they're the only staff available to provide care, then that's going to mean they're going to disrupt the parent's schedule as well because the parents won't have access to childcare. And the last thing we wanted to highlight in this pillar was representation and diversity. Simply put, parents want to see themselves and they want to see their child represented by the provider and within the center or the home. So what that looks like is the provider speaking the same language as either the parent or the child, the provider being the same race as the child, or seeing other children of the same race in the classroom. And also a classroom and a teacher that honors and celebrates different customs and cultures. So what's important to note is that we heard this from all parents, not just parents of color, but from all parents. Everyone wants their child to see and celebrate different races, cultures, and customs, regardless of their own background. And so this is really important to them. When we're thinking about the trust pillar, we heard that trust is often strongest in in-home or kin care setting. And this is often because in these settings, providers are related to the parents or children or have known them for a long time, which creates that trust bond. There are also often fewer children in these settings, which means that parents feel that providers can pay more attention to their child. And there's often also more flexibility. So for example, if a parent needs a few extra minutes per child, if they're running late from work, or if they need maybe a few extra days to pay their childcare fees, a lot of times the in-home and kin care setting provides some of that flexibility. The other thing we heard is that star ratings do not translate to trust. So we heard from more than 514 respondents, and star rating was really only mentioned by a handful, and truly a handful of respondents when it came to using star ratings to determine trust or to even be a determining factor in finding a childcare provider. There were a few parents who used the star rating to help find a provider, but most of the time parents are either not aware of star ratings. Parents don't know how to access star ratings. So they had heard of them, but they didn't really know where they would go to find that information. And again, in the sessions, we heard that some people were sharing with one another how to find that star rating if it came up. And then quite simply, they don't value those star ratings. So there's maybe an understanding that there's maybe a loose correlation between higher stars and higher quality of care, but they don't necessarily feel that is always the case, or that the star ratings are rating the things that are most important to them. And it also provides, or means that care might be more expensive, which they see as inequitable. We talked about in-home and kin care often being the most, where trust is often the strongest, but it's also an area where parents don't feel like those settings have access to stars because there's a lot of red tape or bureaucracy that's involved that these centers or providers don't have access to. And so it could be a center, in-home center that they really find trustworthy, but they don't have a star rating or the star ratings don't correlate. So we wanted to highlight some of the barriers that we heard when it came specifically to childcare trust, and then what might be some things to address these barriers. And we're not going to go through every single one of these because there's a lot here, but we wanted to hit on some of the highlights. So one of the barriers to trust was availability and accessibility of in-home or kin care. And so addressing some of these barriers might be to lower the barriers to entry so more people can become an in-home or kin care provider. Also using vouchers so that those providers are reimbursed at the same rates and allowed as traditional centers. And then really lowering the burden for these providers to access star ratings and fundings. As we heard, star ratings can create an inequitable system for both parents and providers. So examining how quality is defined in QRIS so it better aligns with how parents define it. Providing funding to help centers earn star ratings and ensure that those 4- and 5-star rated facilities are accepting children from all backgrounds. Again, leaning into that representation that really goes a long way in establishing trust and equity. Making sure that representation and diversity of children are represented within the classroom. So increasing equity and accessibility of childcare, and ensuring that there's more providers of different backgrounds and who speak different languages that are entering into early childhood education so that children and parents see themselves reflected in the providers. And lastly, providing a centralized portal with information about childcare and parent resources. And the caveat here again is this is what we heard from parents and providers. So it might even be raising awareness of this information and these portals, but working with the community and state to create that online portal for both providers and parents. So that was the trust pillar. We want to move now on into affordability and talk a little bit more about what goes into this pillar. So it probably goes without saying that in nearly every county that we listened to, childcare affordability was one of the key barriers to access. And many times the cost of childcare is so high that it's really the deciding factor of whether a parent, which is most often the mother, and we'll talk about that in a moment, can work or not. And then for those who are using childcare services and are working, those childcare services take up a significant portion of their paycheck. We didn't hear a whole lot of parents saying they had to sacrifice food or shelter to trade off for childcare, but what we did hear was that those costs mean that parents often have to sacrifice other bills or sacrifice pursuing their own dreams and careers, or taking jobs that might pay even more money so that they can pay the childcare bills. So let's dive into this pillar a little bit more and talk about what makes up childcare affordability based on what we've heard from the parents and providers within the state. So the first is vouchers. And one thing we want to note is that vouchers are truly a lifesaver for some. We heard from parents that without them, they would not be able to afford childcare. However, we also heard from many families that even with vouchers, they are struggling to pay the parent fee, especially when they have to account for all the other expenses that go into a family, especially if they have larger families. And we heard from providers that where they do have some extra grant money that existed, we heard some providers having some leftover COVID money, for example, that they are trying to help parents out as much as possible by waiving that parent fee or allowing parents to float their monthly payments so that they can ease some of that burden. The other thing that we heard from those parents who are using vouchers is that there are some who make just over the threshold, even by a couple dollars. And so they no longer qualify for vouchers. And so they are in this impossible situation in which they desperately need the vouchers. They don't make enough to really truly afford childcare, but now the voucher is out of reach to make childcare affordable. So it really disincentivizes them to make more money or to try to earn a better life for their family because they're stuck in the system that that they make any more money, they're really not going to be able to afford childcare and not be able to work. We also heard that some families find it difficult to qualify for vouchers. Some don't know where to go to find the guidelines for vouchers. And this is reflecting, echoing the sentiment that we heard earlier about finding providers. They don't know where to find the guidelines for vouchers. Vouchers existed until they stumbled upon it. And this is especially true for parents who might be immigrants or who don't speak English as a primary language. And so they really want a way to be able to navigate that system better. We also heard some say that they need a voucher in order to, they need employment in order to qualify for a voucher, but they can't get employment unless they have childcare. And so they find themselves in this impossible catch-22 situation and often find themselves in limbo. We also heard that not all centers take vouchers. And so sometimes parents have to trade off quality childcare for affordable childcare, which again, we talked about that quality translating to trustworthy. And so they feel like they're not always putting their child in a place that is safe, or they are choosing not to put their child in childcare because they don't feel like it's safe and they can't afford anything else. And then we also heard that vouchers don't always cover family or kin care, as we talked about earlier, which is something they really trust. And we also heard from immigrant voices that they don't always qualify for vouchers. They feel that they have to provide legal documentation or tax records, which really shut them out of the system altogether. Lastly, there's a social stigma that creates this feeling of discrimination that parents may already feel. So again, we heard from some immigrant parents that they don't believe they qualify for vouchers, and so it makes them uncomfortable to provide documentation if it's needed to. And other people just felt embarrassed or less than when they're applying for vouchers, which again creates a barrier. The other aspect that goes in as a barrier that goes into affordability is the lack of free or low-cost childcare options. We heard that the cost of childcare means that parents often decide not to work in order to provide their own childcare. And some parents are really proud of this decision. They want to be in control of their child's experiences and education. But we also heard many other parents that feel like they just don't have a choice. They would prefer to work, and so they could provide better financial stability for their family. But the high cost of childcare means that most of their paycheck is going to go towards childcare, and they just can't make that work. It's just not worth it to have childcare. So they're not able to fulfill their hopes and dreams. And we even heard from some parents who've completed higher education. They want to put that degree to work, but they feel cheated because they're not able to do that because of the cost of childcare. And then we also heard some parents, because they're not able to afford childcare, they're trading off duties with the other parent. So one child will watch the child while the other one works, and then vice versa. And so often this means that they are ships passing in the night. They barely see one another. It creates emotional strain within the family. Building upon this, what we heard is that because cost of childcare cuts significantly into people's paycheck, they're really not able to become as financially dependent as they would like to. And we also heard that those who might have inconsistent income really struggle to piece together childcare so they can look for work. So without childcare, they're not able to go to interviews, and so they really have to either find a babysitter or find other people who will pitch in. And this often not only creates emotional strain of having to piece this together, but also financial strain because these childcare options are often very expensive. Costs. It sounds like there's an outdated and ineffective voucher system. And so there's an opportunity to increase education around voucher availability and qualification, raising the earnings ceilings for qualification, allowing vouchers to be used across all settings, and ensuring that parents have access to vouchers, allowing an unemployment grace period or extending that grace period with vouchers, and expanding the number of centers who accept vouchers so that parents aren't trading off between quality and affordability. The use of star ratings to allocate funding to providers or childcare pricing. There's ways to provide incentives or require highly rated star centers to accept vouchers, and really providing feedback to help centers earn star ratings. And we heard that availability of childcare centers often hinges on grant opportunities. So more equitable grant allocation allow centers funding, sharing grants for a longer period of time to help that burnout and drain on provider pay issues to really eliminate the need for grants altogether. So I'm going to pass it over to Grant to talk about availability.
Thank you so much, Laura. So yes, the last pillar we would like to talk about here when it comes to quality childcare is this availability. And we'll cover all of these topics here, but first we want to provide a little bit more context around availability, and we'll do this through a couple quotes here. One that I want to highlight is this parent from Buncombe County that said, "Every childcare provider I know has a second job, so they aren't getting paid enough. Our society is missing the public investment in early childhood education. If we had it, they would make the investment like they do in K-12. Early childhood education doesn't have that at all. They think they're babysitters, but they are teachers, they're educators, it's a school." So to begin with how we identified and how we defined availability when it comes to early childhood education is first these well cared for providers. It's no secret that there's high turnover in the industry. Providers are burned out, they're undervalued. And we've identified several reasons why this is the case. The first of which is providers are simply feeling underappreciated. This is happening at multiple levels, at the community level, at the state level when it comes to legislation and laws, and even with some parents in their day-to-day interactions. Providers are also feeling overwhelmed because they don't have the resources and trainings that they feel are critical to succeed in their role. Among these resources, for example, are mental health resources. We know that early childhood education can be physically taxing, it can be mentally and emotionally taxing, and they need these resources in order to succeed. However, trainings are also essential here, especially when it comes to providing care for children with developmental disabilities or other limitations that providers currently might not feel equipped to deal with. Additionally, here providers feel they are undervalued from a monetary or a financial point of view. They feel that they're not paid according to the value they provide, especially when you compare them to other K-12 educators and the compensation that they receive. Additionally, when it comes to defining availability, when it comes to early childhood education, is this need for short transportation times. As Shonda said, we spoke to providers and parents in 34 counties across the state, and we found in many of those counties with fewer childcare options, especially in rural counties, parents are often driving up to 30 minutes or more to access their childcare options. Not only does this impact their finances, because they're having to pay for more gas money, for example, but it also means that they're frequently taking time off of work in order to cater to the schedules of the limited childcare options. We found this is especially a problem when it comes to the NC pre-K classrooms that follow traditional school hours. These shortened days mean that parents have limited availability in terms of the job opportunities that they are able to take. Next, we'd like to speak to the need for no wait lists. This is a common complaint across the entire state. We've already spoke to staffing shortages and the limited availability of childcare options. But what this means is there's extremely long waiting lists for parents who are trying to get their foot in the door of early childhood education. What this means is these waiting lists create stress and frustration for parents. It limits their employment opportunities because frequently parents feel that they need to take care of their own children in the meantime while they are actively on this job hunt. Some feel the difficulty in opening in-home centers also contributes to childcare shortages in the county. Another result of these extremely long waiting lists is this creation of a sense of competition and elitism among the centers. more highly valued centers, especially ones with higher star ratings, which Laura has already spoken to, have even longer wait lists. And what this means is they can end up charging more for their services because they understand the demand will be there regardless. And what this contributes to is a sense of inequity among access to these particularly highly valued centers. Next, we'd like to speak to accommodating childcare hours and how this is essential to creating availability within early childhood education. There's a need for more flexible and non-traditional childcare hours to cater to parents who might not work a traditional 9-to-5 schedule, for example. We spoke to many parents across the entire state who work in the service industry, those who might have third shift jobs or work in the gig economy, for example. What this means is these parents who work in these non-traditional industries or jobs have difficulty providing their kids the opportunity to attend childcare. Without these flexible or non-traditional hours, we found that parents are frequently relying on drop-in centers, which can be prohibitively expensive in many cases, or also relying on family and kin care. This is creating additional burden on family and friends. Second to last here is the need for resources in multiple languages. Again, we spoke to many parents across the entire state. Several of them were immigrant parents or those who do not speak English fluently. Maybe it's a second language for them, or maybe they don't speak English at all. They often feel that childcare options are simply not available to them at all. If they are able to find childcare options, they still struggle to find information about the childcare options in terms of availability or access. Centers that might offer English or Spanish, bilingual services. We've also identified that there's a significant need for resources surrounding financial assistance for childcare in Spanish. We know that these resources are even hard to identify in English, and so finding it for these parents who don't speak English or only speak Spanish is again extremely difficult. Most of the providers in these centers do not speak Spanish fluently. In many cases, they're relying on children to act as intermediaries or translators. In some cases, they are using Google Translate, and in rarer cases, they might have a translator on staff, but frequently it's a single one. What this means is that it does not create the sense of trust, inclusion, or belonging that we've identified earlier as being essential to a successful childcare relationship. Additionally, some parents need legal status to enroll their children, which is particularly limiting for families who might not be in this particular position. The last element here of availability when it comes to early childhood education is a location for centralized information. We found this across the board in almost all of the counties that we talked to in the entire state. They are lacking a centralized location to access critical resources about the availability of childcare centers, as well as assistance resources, especially when it comes to financial assistance. This was prevalent for both parents and providers. Parents wish there was a place to find information. Currently, they are relying on word of mouth. Often they are doing their own research, which can be difficult, especially for many of these parents who are working odd hours or working many hours. Providers also wish they had a centralized location of information. They wish they were able to provide parents with these resources, but often don't feel like there's a sufficient manner in which to do so. They are often making recommendations themselves or pulling together information to try to provide to parents, but across the board, lacking this centralized location in which to do so. Now that we've identified these critical needs when it comes to creating childcare availability, we also want to speak to some ways that we can address them. The first is when it comes to these staffing shortages and the high turnover, we have to find ways to attract providers to the industry while also figuring out ways to retain them. I won't go over all of these in depth, but among them are providing the mental health resources and the trainings that are critical to their success. Additionally, providing comparable benefits to public school teachers and other K-12 educators. In doing so, we can also tackle the issue of long wait times. We need to increase the number of providers in the industry by attracting and retaining them, as well as increasing the number of centers within the community. Furthermore, again, addressing the issue of long distances and long commutes to and from the childcare centers. This is especially going to be important in rural communities. We need to work with the communities in order to equitably distribute these centers so that they're not simply congregating in affluent areas where parents can afford to pay out of pocket, but making sure that there's equitable access to childcare. And then lastly here is going to be addressing the need for non-traditional hours. Once again, if we can attract more educators and providers to early childhood in North Carolina, we can increase the availability and also incentivize these centers to provide these hours to accommodate parents who might not work a traditional schedule. And then I will pass it over to Laura here to talk about our last couple slides.
Thank you, Grant. I know we're running a little bit short on time, so there's just 2 more points that we'll make quickly. And again, this information is within the fuller report. But one thing that we heard over and over again is that childcare scarcity means that the burden almost always falls on women. And so it's something for us to think about as we think about childcare or the barriers to childcare and early childhood education within the state, what that means for women, what that means for the economic opportunity for women within the state. And so we heard a lot about this childcare crisis in North Carolina. And it also makes us wonder, as we heard these women's voices, if this is also a crisis among women and contributing to female burnout. The other piece that we just wanted to touch on quickly was that there was, as Shonda mentioned, a separate analysis that was done on the Western counties. And so overall, what we heard in the Western counties really echoes what we heard throughout the rest of the state. But there were some barriers that were exacerbated in the Western counties. There was a greater sense of stress and frustration because these Western counties often feel overlooked and forgotten. And so it can be extremely frustrating for them to see other counties have access to resources that they do not. So a few areas we wanted to call out within the trust pillar was that we heard that star ratings have very little meaning throughout the state, but it's even more meaningless in the counties which already have few childcare options. And we heard there's a real scarcity of childcare options in the western part of the state. Affordability, we heard even more so that parents in the western part of the state struggle to afford childcare options, and really vouchers aren't as much of an option for them for parents who need them. And again, we heard that providers are really struggling to keep up with their own funding as well. And again, especially in an area that does not have a lot of childcare options. And then availability. The western part of the state is really a childcare desert. And it's interesting that we heard that term used by many providers and parents in the western part of the county. And so that means a lot more parents are staying home with their child out of necessity and not out of choice. We also heard a lot of value for Head Start and early Head Start, but access is really limited in this part of the state. So there might be an opportunity to increase access to those 2 programs. So that is everything, not everything, that is a little bit of the iceberg from what we heard from all of you. And I know that is a lot, but again, there is more information in the full report. But Shonda, I will pass it back over to you.
Thank you so much, Laura and Grant, for all of this great information. I am looking in the chat and we are really tight on time. So if you have any questions, please make sure to put them in the Q&A. And when we send out the recording, you will get a follow-up email with the recording from today's session. along with the PowerPoint presentation in English and in Spanish, and a FAQ document, so frequently asked questions. So all the questions that you ask, we will save the chat, we will take them from the Q&A, and we will make sure that we provide answers to those questions in the follow-up. The full report, I see that a couple people has been asking about the full report. Full report will be released. It's like 110 plus pages. So that will be released in the next couple of weeks. And to get more information about the exact date on that, of when that is going to be released and how, please get connected to our CandL newsletter. And Lindsay, if you could drop that link for them to get connected to the CandL newsletter in the chat again, that will be great. And so, yes, you all will be able to have access to the full report to see the details from each of the counties, as well as this PowerPoint presentation. Or that will be sent out to everyone who is actually registered for this webinar. Also, before I turn it over to my right hand, Muffy is my left hand and Devanya is my right hand, my right and left hand. Before I turn it over to Devanya to close us out, Lindsay will also drop in the chat a call to action. And this is a way that you can take action as it relates to child care subsidy. And so feel free to click there and take some action now to get involved in some of our short-term ECE work. So Devanya, I am going to turn it over to you.
Awesome. Thank you, Shonda. And thank you everyone who actually tuned in today and spent time with us listening through this very, very important information that was collected. I just want to give you a few updates on how we move forward. To a point that Shonda made earlier about the phase 1 work, the phase 1 work will continue. We will continue to have people out on the ground, talking with families, having conversations with providers, with all sorts of practitioners to help us understand better about the lived experiences of the citizens in North Carolina and how we build a more equitable early care and education system. Phase 2 will be happening actually very, very soon. And that's when we actually complete the visioning for this campaign. So to Shonda's point earlier, we will take what we learned thus far and what we'll continue to hear from families and compare it to the original vision and make sure that we kind of compare and contrast the two and make the adjustments as needed so that we know we're fighting for the right things. We hope that you found this information as valuable and as helpful and as informative as we did. We can make assumptions all day long about what we think the families in North Carolina need or want in terms of raising whole, healthy children. This is an opportunity to hear it exactly from their mouths in their own words so that we are fighting for the right things. And to make sure that we are accommodating as many of our children, as many of our families, as many of our providers as possible as we decide, as we work towards creating a more equitable system, work towards flipping this thing upside down and designing something shiny and new and that works for the people of North Carolina. We are interested in hearing how you want to continue to be engaged in this work. Your voices are just as valuable. Your experiences are just as valuable. There is a place at the table for, you. So if you could drop in the chat, if you know at this point how you want us to engage, continue to engage you in this work, that would be super helpful. Our families, our phase 1 participants, those individuals, those grassroots organizations, the families and providers will actually continue to be engaged by receiving training because they want to be able to deliver this message in their own communities, in their backyards, at the barbecue. They want to be able to have these conversations with as many people as possible so that our families and our citizens feel like they're not alone, that their struggles, their challenges, their desires for their families are unique to their own personal situation. So they have asked that we continue to engage them in that way. And we want to hear from you. How do you want to be engaged moving forward? So I think that's it. Again, I want to thank you for your time. Thank you for your interest. And together we will create a more equitable system early care and education system and make North Carolina one of the best states in this country to raise children and families. I'm going to turn it back over to Shonda. Thank you.
Thank you all for joining us today. We are so glad that you are so excited about this data as we are. And we are going to push this train forward in building this long-term early care and education campaign to make all the children's lives better so that families have choices that actually work for them. And all of that good stuff. So thank you all. Enjoy the rest of your Tuesday, and we will talk soon. Bye.